for co-hosting this summit with the United States. Today, we're again uniting countries around the world with leaders from the private sector, civil society, and the philanthropic community to carry forward the vital work on fighting COVID-19 everywhere, not just at home, everywhere. You know, when we met last in September, we were focused on critical and urgent challenges. And I'm incredibly proud of the work that we've done together over the last several months and the commitments that we have made to vaccinate the world. You know, for our part, the United States has provided more than $19 billion to help countries fight COVID-19 all around the world. We provided life-saving medicines, oxygen, tests, equipment, supplies, and partnered with countries to improve their capacity to manufacture vaccines as well. We've delivered more than 500 million vaccines to 115 different countries. And we're going to continue to work with COVAX to deliver another 500 million doses, all part of the pledge we made to donate 1 billion doses of vaccine to the most vulnerable in the world. You know, all this is completely free. No strings attached. But, you know, there's still so much left to do. This pandemic isn't over. Today, we mark a tragic milestone here in the United States. 1 million COVID deaths. 1 million empty chairs around the family dinner table. Each irreplaceable losses. Each leaving behind a family, a community, forever changed because of this pandemic. My heart goes out to all of those who are struggling, asking themselves, how do I go on without him? How do I go on without her? What will we do without him? It's grief shared by people across all of our nations. Around the world, many more millions have died. Millions of children have been orphaned, and with thousands still dying every day, now is the time for us to act, all of us together. We all must do more. We must honor those we have lost by doing everything we can to prevent as many deaths as possible. Today, we're at a new stage in fighting this pandemic, facing an evolving set of challenges. We have to double down on our efforts to get shots in people's arms, country by country, community by community. Ensure we have reliable and predictable supplies of vaccines and boosters for everyone, everywhere. Expand access globally to tests and treatments. And we have to prevent complacency. This summit is an opportunity to renew our efforts, to keep our foot on the gas when it comes to getting this pandemic under control and preventing future health crises. Collectively, we're making significant new commitments to help keep up the fight against COVID-19 in 2022, protect the most vulnerable populations, and prepare for the next health crisis because there will be others. You know, and the United States is going to continue to do our part. Today I'm announcing the United States will share critical COVID-19 technologies through the World Health Organization COVID-19 Technology Access Pool. We're making available health technologies that are owned by the United States government, including stabilized spike protein that is used in many COVID-19 vaccines. We're standing up a new pilot program working with the Global Fund to expand access to rapid testing and antiviral treatments for people in harder-to-reach areas. And we're increasing our support for a new pandemic preparedness and global health security fund that will be established at the World Bank this summer with $450 million in seed funding. I particularly want to commend Indonesia and Italy for their leadership in helping make this fund a reality. And I'm encouraging other leaders to join me in upping their commitments. You know, we're going to face together global health crises. This is not the last one we've had. It's not a question of if, it's a question of when. So we have to invest now. We have to secure political commitments now. We have to start working to prevent the next variant and the next pandemic now. And that's going to require all of us to do more. I encourage every leader to ask yourself, what more can I do? How can we work more closely together to help more people? How can we save more lives? That's why I continue to call on Congress here at home to take the urgent action to provide emergency COVID-19 funding that is vital to protect Americans, to make sure that we maintain our supplies of COVID-19 tests, treatments, and vaccines, including next-generation vaccines that are being developed. The request also includes $5 billion to keep up our global partnership in the fight against COVID-19 and sustain our efforts to get shots in people's arms all around the world, expand access to treatment, and save lives everywhere. We can do this. We can control COVID-19. We can start to build a better, healthier, and more secure future today if we all do our part and if we step up together. So thank you for responding to this fight, and most especially, thank you for all the doctors, nurses, and community health workers, and scientists, and aid workers, and anyone and everyone on the front lines fighting this pandemic, saving lives every single day. We owe you. Thank you. God bless you all.
Thank you to President Biden, Vice President Harris, our distinguished co-hosts, partners, world leaders, and everyone tuning in today. Together, our efforts will help end this pandemic, which has caused so much pain and disruption. My name is Linda Thomas Greenfield, and I have the honor of representing the United States at the United Nations. When we convened the last summit, I said that only a truly global response can meet this moment. That was just over 7 months ago. And in that time, our global efforts have saved countless lives. The United States, in partnership with COVAX and others, hit a critical milestone, donating over 500 million vaccine doses to over 115 countries. We provided more than $19 billion in COVID assistance, ranging from health, humanitarian, economic, and development support. But we know supplying COVID-19 vaccine isn't enough. We also need to accelerate vaccine uptake and ensure vaccines make it into arms quickly and equitably. That means tackling difficult cold chain supply issues, addressing vaccine hesitancy, and expanding distribution support. And that's why we launched the Global Vax program to further ramp up COVID-19 vaccinations around the world, providing resources to more than 70 countries and surging support to 11 developing countries in sub-Saharan Africa to reduce vaccination barriers. I've had the opportunity to travel around the world, from Niger to Thailand, and I've watched the vaccines we've donated actually go into arms. I've seen how our assistance has protected vulnerable populations and frontline workers from sickness and death. But our work isn't done. In total, we'll ship out 1.2 billion doses across the globe with no strings attached. We're doing this because no country can end COVID alone, and we're committed to increasing vaccination rates for every country. Today is about keeping up the momentum and saving lives. As the disease continues to evolve and new strains emerge, our strategy to defeat the pandemic must also evolve. Let's marshal our collective knowledge and resources to distribute more vaccines, expand equitable access to testing and treatment, and support healthcare workers. At the same time, let's also keep our eye to the future so we are better prepared to prevent and respond to the next pandemic. The investments we make today to strengthen our health systems, protect those in need, and make access to vital resources more equitable will pay dividends for years to come. And that's why we're focused on advancing global health at the United Nations, where I'm working with coalitions on antimicrobial resistance, global health, security, and universal health coverage. We have to come together, bilaterally and multilaterally, to ensure our global health system is as strong and prepared as it can be. And now I'm pleased to introduce President Macky Sall, African Union Chair and one of the co-hosts of today's summit. Senegal's COVID-19 response and recovery efforts through a go early, go hard, and keep it simple approach is an example to all of us. Mr. President, over to you.
Thank you, dear Linda.
Thank you very much, dear colleagues, ladies and gentlemen. I would like to acknowledge and thank President Joe Biden for his invitation to this second COVID-19 pandemic summit. I salute our fellow co-organizers, President Widodo, Chancellor Scholz, and Prime Minister Briceño. I also salute the presence of the heads of state and government, and in spite of the improving situation, the holding of this summit shows that we must not let our guard down and that we must be prepared for other potential health challenges. In Africa, we have been able to remain resilient in the face of COVID-19, with relatively few positive cases and deaths compared to the rest of the world, whereas the worst was feared. Our countries have adopted response strategies, each within their means. We have also coordinated our response efforts at the continental level under the leadership of President Cyril Ramaphosa of South Africa, with the support of the African Union Commission and Africa CDC. I thank the partners for the donations of vaccines through the COVAX, AVAT, and bilateral cooperative initiatives. All of these countries need to be thanked. I would like to draw the attention of our summit to 4 priorities for Africa. 1, universal access to vaccines and improving immunization rates. Because today, the populations quasi refuse to be vaccinated. We have to come up with new strategies to have the vaccines be accepted. Secondly, accelerating the process of local vaccine production. Some African countries are already producing the COVID vaccine. Others, including Senegal, are preparing to do so very soon. I recall that last February, the 6th Europe-Africa Summit launched an initiative for the production of messenger RNA vaccines in 6 African countries: South Africa, Egypt, Kenya, Nigeria, Senegal, and Tunisia. We call for greater diligence in the implementation of this initiative. 3rd priority, Africa wants locally produced vaccines to access marketing and distribution platforms such as Gavi. This is what will make local vaccine production sustainable. We held a meeting on this subject on May 10, 2 days ago, in order to advocate the purchase of vaccines produced on the continent. Number 4, we are advocating the establishment of a more inclusive new world order of public health, more inclusive for better handling of cross-border health issues. Finally, In terms of national commitments, I would like to point out that the Pasteur Institute in Dakar is building a new biotechnology platform with a component for the production of vaccines against COVID-19, as well as other diseases. In support of this project, the state of Senegal has made a 3.3 hectare site available to the Institute, and we have mobilized a funding of $91 million, including a loan from the EIB of $79 million. This project also is benefiting for $14 million in grants for the World Bank, from DFC, also the BEI and the EU and the French Agency for Development. The total cost of the project is of $220 million. And to conclude, I would like to applaud the American initiative to organize this summit. I would like to thank you, the director of the WHO, for his participation in this fight. I would like to salute all our friends, such as Mr. Trudeau, President Sanchez, who are along our sides. Thank you very much.
Thank you, Mr. President. I'm pleased to give an opportunity for our second co-host and G7 President, Chancellor Olaf Scholz, to discuss Germany's COVID-19 response efforts, as well as how they fit into the overall global response. Mr. Chancellor, thank you for your leadership, and you have the floor.
President Biden, Vice President Harris, co-hosts and colleagues, ladies and gentlemen. A well-known quote says that perception is reality, but the COVID-19 pandemic is proving this wrong. Our perception might be that COVID is over. Russia's war of aggression against Ukraine has overtaken the pandemic in the headlines. And after more than 2 long years, people are simply tired of hearing and reading about COVID. But the dire reality is the pandemic is not over. More than 6.2 million people around the world have died from COVID-19. That's about the entire population of Singapore or Denmark. And every day more people are dying. Current outbreaks and new variants of concern show the risk of prolonging the pandemic even further. For many countries, especially in the global south, this is a disaster, because the pandemic comes on top of other serious challenges such as food shortages, rising energy prices, and the effects of climate change. As a result, global debt and inflation are increasing rapidly. So what is needed? The short answer is money. The ACT accelerator must remain our top priority. As the holder of the G7 presidency, Germany wants to lead by example. For 2022, we are contributing another $1.5 billion US, increasing our support since 2020 to $3.5 billion. In addition, we have already donated 145 million vaccine doses. Recently, we hosted the COVAX financing conference together with Gavi. This raised a total of $4.8 billion US. But there is still significant funding gap, which we must close together. This is why we are here today. Secondly, we must recognize that reality has changed. In 2021, we were short of vaccines. In 2022, we have the vaccines, but we are lagging behind on vaccinations. We therefore need to strengthen absorption capacities, especially in countries with weak healthcare systems. As part of our last mile initiative, Germany will provide 850 million euro to our partner countries, especially in Africa and the Middle East. Thirdly, we need to look beyond the current crisis. In order to be better prepared in the future, we must strengthen the World Health Organization and its coordinating role. The good news is that the WHO Working Group on Sustainable Financing has just reached an agreement to put the WHO program budget on a more solid financial footing. This will enable the organization to carry out its important job more effectively. Fourthly, we need more local production of vaccines against COVID and in the longer term against other diseases such as malaria or Ebola. Germany is currently investing more than 500 million euro to expand local vaccine and medical manufacturing in Africa. Our pharmaceutical industry has stepped up its commitments as well. But we also rely on your continued support via Gavi, the Global Fund and other multilateral instruments. Finally, we need ongoing support to build resilient healthcare systems. This is where President Biden's initiative comes in. We support your proposal, dear Joe, to set up a new fund for pandemic preparedness at the World Bank, operating in close coordination and cooperation with the WHO. And I'm happy to announce today that, subject to parliamentary approval, Germany will contribute an initial 50 million euro. We look forward to working with you on setting up the fund and turning it into a global success story. So thank you all for joining us today. Together we can make this summit a success. By taking action, we can change reality.
Thank you, Chancellor. Thank you for that strong commitment. Now I'm delighted to hand the floor over to another co-host, an effective leader who has played a critical role for the global COVID-19 response and recovery efforts, and particularly in his current role as G20 chair, Indonesia's President Joko Widodo. Mr. President, you have the floor.
President Biden, distinguished world leaders. The COVID-19 pandemic teaches us a very important lesson. Global health, resilience, and preparedness for pandemics is not strong enough. As a result, the price we paid was very high. Millions lost their lives, and the global economy faced recession. Therefore, we must work together to mitigate the pandemic and build a stronger global health architecture and preparedness. To mitigate the pandemic, vaccinations must be expedited to cover 70% of each country's population. The current momentum of reduced cases must be utilized to deliver the final blow against COVID-19. Vaccines must quickly become vaccinations. Our collaboration must bridge the challenges of vaccination from financing, logistics, and human resources. Meanwhile, to build a stronger global health architecture and preparedness, at least three things are needed. First, inclusive access to health. All peoples, without exception, must have access to essential health services. Health infrastructure must be adequate and equipped for pandemics. At the global level, all countries, big or small, rich or poor, must have equal access to health solutions. Second, adequate access to financing. Not all countries have the resources to improve their health infrastructure. We need a new health financing mechanism that involves donor countries and multilateral development banks. Support for health financing must be viewed as an investment as well as collective responsibility to prevent pandemics. Third, empowerment. Collective capacity must be built and international cooperation becomes key. Research cooperation, transfer of technology, and access to raw materials must be strengthened. There should be no monopoly in the health industry supply chains. Diversification of production centers of medicine, vaccines, diagnostic and therapeutic equipment must be implemented. In its capacity, Indonesia stands ready to become a production hub for vaccine production and distribution in the region. Excellencies, Indonesia's G20 presidency brings great attention to inclusive health cooperation. For this, the role and participation of all countries are required. WHO and multilateralism must be strengthened. No one should be left behind in our effort to build a stronger global health architecture and preparedness. Recover together, recover stronger. Thank you.
Thank you, Mr. President. Now I will turn to Prime Minister Johnny Briceño, who can speak about COVID-19 response and recovery efforts in the Caribbean, especially as CARICOM chair. We're grateful for his partnership and leadership. Mr. Prime Minister, you have the floor.
Excellencies, greetings. Thank you, President Biden, for convening this second COVID-19 summit. I also welcome the other co-hosts and extend thanks to everyone for your commitment to lead on the global response to the pandemic. Thus far, significant advancements have been made in areas such as surveillance, testing, rapid development of vaccines, and antiviral treatments. As a result of this, many countries are witnessing declines in serious death cases and deaths. But the pandemic is not over. Global testing rates have been declining. Presently, low and low-middle income countries account for only 20% of testing globally, even though we account for over half of the global population. Recent figures show a 15.4% increase in new infections in the Caribbean. Deaths increased for the third consecutive week by 39.6% as compared to the previous week. According to the WHO, reported cases in Africa are also rising. Many countries, including several in CARICOM, are far below the targeted 70% of the population vaccinated and are unlikely to get there by September. Low testing, lack of capacity in sequencing, lack of access to vaccines, and high cost of treatments slow the pace of ending the acute phase of the pandemic and create a global environment conducive to virus mutation. As well, it undermines the good progress that has been made. Presently, Latin America and the Caribbean has been the hardest hit region in the world, accounting 20% of infections and 30% of deaths from the virus. This while our region accounts for only 8% of the global population. As it relates to our economies, in 2020, Caribbean economies contracted on average by 6% above the 4.4 contraction worldwide and grew on average by only 1% last year. We say then that now is the time to double on what we know works: testing, vaccination, treatments, and appropriate public health measures. We must accelerate efforts to inoculate 70% of the global population, especially those with comorbidities. CARICOM is committed to this global goal. To get there, however, will require more efforts to improve accessibility to vaccines, including pediatric vaccines. Likewise, financing and political commitment are required to overcome operational and logistical impediments in difficult to reach areas and to access vaccine hesitancy. In Belize, 59% of our population are fully vaccinated. We hope to soon access pediatric vaccines to further enhance the number of persons fully vaccinated. Excellencies, CARICOM leaders are committed to redouble communication messages and accelerate public education efforts to address this misinformation, myths, and other drivers and enablers of vaccine hesitancy at all levels. CARICOM heads have further directed regional institutions to examine the social and financial viability to develop vaccine manufacturing capacity for the region. Access to vaccine in a timely manner has been a critical weakness of the global response. At the same time, we must maintain access to testing and to sequencing, which are essential to detecting, tracking, and responding to new COVID variants. Belize, with the support of international partners like the US government and the World Bank, received geometric sequencing equipment to detect COVID-19 variants, as well as the related training for our laboratory technicians. This is helping us to develop our capacity to analyze virus samples. We know that the next battleground in our fight against the pandemic will be in treatment. Therefore, we must do all possible to ensure that antiviral medications are available to everyone as soon as possible. Access to treatment in our present is our moral test, and we must not fail. So let us strengthen the global health architecture and ensure it is sustainably financed. As for us in Belize, we are doing our part. We have increased our budget for health, expanded our national health insurance to cover more Belizeans, and strengthened our awareness campaign. Excellencies, important lessons have already been learned from the pandemic. Some painful, too many tragic. But we can also celebrate the victories, like our power to collaboration and cooperation, like the depth of human ingenuity and brilliance we have seen in so many of our people, like the compassion, empathy, and solidarity spread across oceans and seas, like the unprecedented public-private partnerships we have fostered, including today's summit, which stands on the foundation and is imbued with that spirit. This is how we overcome this pandemic, working together as one global family. Once again, to President Biden, to the heads of state of Indonesia, Germany, and Senegal, leading this summit, and to all gathered in this viral space, I thank you.
Thank you, Prime Minister. In this work of strengthening health systems and global health security, I'm grateful to have joined forces with Vice President Harris, who has charged forward with the urgent work of preventing, detecting, and responding to future public health threats. And now I have the privilege of introducing her. Madam Vice President, the floor is yours.
Thank you. Thank you, Madam Ambassador. And thank you, all of you, for co-hosting this very important convening. Prime Minister Bersenio, the President, of course, Sall of Senegal, and Chancellor Scholz, and President Widodo. Thank you all, and I also see my friend Prime Minister Trudeau and President Sanchez. I want to thank you as well, and everyone who is here with us today. Today marks a solemn milestone for us in the United States, the loss of 1 million American lives due to COVID-19. 1 million lives. Today and every day, we remember them, of course, and we honor them. And I send my prayers to their loved ones, and I recognize all the pain that has been endured by them and those who have lost loved ones around the world. I believe we owe it to their memories and to the millions of other lives lost around the world to renew our fight against this deadly virus. Which brings me to why, of course, we are all gathered here today. Over the last 2 years, as we all know, COVID has had a devastating impact on people around the globe. Economic shocks, a massive disruption to so many parts of our daily lives. And of course, yes, we have made remarkable progress, yet without continued action, lives and livelihoods will continue to be at risk. This is why our administration is hard at work in Washington, D.C., doing everything we can. As you heard just a moment ago from President Joe Biden, there are a number of ways in which we have and will continue to take action. We have called upon the United States Congress for $22.5 billion in additional emergency funding to battle COVID. $5 billion of that would be dedicated to continue our leadership in helping to save lives around the world. We will continue to advocate for these life-saving resources as part of our global commitment. All of you in this headliners session have also taken very important steps and have made key commitments, and we thank you. In our collective words and actions, we are all making clear complacency is not an option. As we gather today, our goals are twofold. One, we must continue to respond to the threat, and two, we must prepare for the future. As long as the COVID virus is present in one country, it impacts all of us. This pandemic, of course, knows no borders, and we must continue to work together to find solutions. We still, as has been said, we still need to make vaccines, tests, and new treatments accessible to all, and especially to those who are highest at risk, the elderly, the immunocompromised, and healthcare workers. I am also aware that countries throughout the world need more training for doctors and nurses and community health workers, and more technical assistance, including freezers, to help get shots in arms. We look forward to partnering with all of you on this. We must also keep an eye to the future. We have learned key lessons in the past 2 years. Lessons about the importance of early detection and surveillance, the need to leverage the private sector and nonprofits to scale production of medicines and tests and vaccines, the transformative power of investments in health systems and health workers, the complicated mechanics of donating and distributing hundreds of millions of vaccines around the world, and the life-saving benefits of a global health security fund. Last year at this very summit, we discussed this particular lesson, and you'll recall I urged us to work together to develop a new financing system and mechanism. Thanks to President Widodo and Prime Minister Draghi, through the G20, we have consensus to establish this fund. And I know we all know and have said it will help us on very critical issues like early detection and warning systems and investments in rapid recovery and response. And this is just the beginning. The way I see it is this. As we think about moving forward, I believe we can also come together, in addition to everything we have discussed, come together to shape new international norms on these issues. Together, we can establish common understandings that guide our collective action, that all countries, regardless of GDP, should have access to life-saving vaccines, tests, and therapeutics, that nations should be transparent and share information early and often, that leaders should prioritize the most vulnerable and the overlooked, and that we must recognize and address inequities in our systems. The future, of course, will present other global health crises, but they don't have to become catastrophes if we do this work together. Now is the time, we know, for bold thinking and concrete action. And I look forward to this discussion and continuing discussions and the work we will do together to shape the future of global health and health security around the world. Thank you all.
Thank you, Madam Vice President. Our next speaker has been at the forefront of COVID-19 efforts in his role as Director General of the WHO. We're facing a world in which we need to be able to manage COVID-19 for the longer term. I'd like to introduce Dr. Tedros Ghebreyesus to discuss his views on WHO's efforts to translate vaccines into vaccinations, expand access to tests and treatments, and build and finance health security capacity at the country and regional level for the next pandemic threat. Dr. Tedros.
Thank you. Thank you very much, Ambassador Greenfield, President Biden, Vice President Harris, Excellencies, Heads of State, Heads of Government, dear colleagues and friends. First of all, I would like to thank the US, Belize, Germany, Indonesia, and Senegal leaders for bringing us all together today. The last time we met in September last year, little did we know that the Omicron wave was just around the corner. So although reported cases and deaths are now decreasing globally, it's misguided to think this pandemic is over. The pandemic is not over anywhere until it's over everywhere. In fact, cases are increasing in more than 70 countries. At the same time, testing rates globally are plummeting, making us blind to the evolution of the virus. And almost 1 billion people in lower income countries remain unvaccinated. We must continue to support all countries to reach 70% as soon as possible, with a focus on those most at risk. Vaccine supply has improved, but absorption has not kept pace due to insufficient political commitment, operational capacity, and finance, combined with vaccine hesitancy driven by mis- and disinformation. Our biggest challenge now is supporting in-country delivery of vaccines. For tests and new therapeutics, the problems are supply side with insufficient funds and insufficient access. The ACT Accelerator is the best way to get life-saving COVID-19 tools to the countries that need them, but it faces a $15 billion shortfall. WHO's own strategic preparedness response readiness plan, our comprehensive roadmap for ending the pandemic, likewise faces a shortfall of $1 billion. I thank President Biden for his announcement that the United States will license several innovative technologies to CTAP. And I welcome yesterday's announcement of the new $1 billion Global Health Workforce or Worker Initiative. At the World Health Assembly this month, WHO will present a plan to strengthen the global architecture for health emergency preparedness, response, and resilience. This includes the creation of a financial intermediary fund to support equitable access to life-saving tools in the face of future epidemics and pandemics. I leave you with 4 requests. First, we call for policy commitments to boost vaccination, testing, and treatment in countries. Second, we call for investment in local production. Third, we call for financial commitments to fully fund the ACT Accelerator and WHO Strategic Preparedness, Readiness, and Response Plan. And fourth, we call for political commitment to support the Financial Intermediary Fund and the new architecture for global health security. I thank you, and Ambassador Greenfield, back to you.
Those insightful comments. Our next speaker has been a champion in the COVID-19 response and in building global health capacity within his own country, across Africa, and in the African Union and around the world. His country continues to make significant commitments to the response. And South Africa has once again stepped up for this summit. President Matamela Cyril Ramaphosa, you have the floor.
Thank you, Ambassador Greenfield, President Joe Biden, Vice President Kamala Harris, fellow heads of states and friends. This second global summit on COVID-19, for which we thank the co-hosts for bringing us all together, takes place at a time when vigilance is required of all of us. As the international community, we are all working towards a swift social and economic recovery, but the threat of new waves and the emergence of new variants is ever present because COVID-19 is not over yet. To avoid a return to the catastrophic early days of the pandemic, we need to get many more people across the world vaccinated. We need to expand access to testing and treatment. We also need to be better prepared for future health crises and generate the financing to do so. South Africa, therefore, supports the formation of the fund as a mechanism to finance global health security. The global health recovery will not be inclusive so long as millions of people in developing economy countries remain unvaccinated. Africa has one of the world's lowest vaccination rates at 16%, and coverage in low-income countries is still under 13%. As African leaders, we are committed to achieving a higher rate of vaccine coverage through mass campaigns across the continent. We continue to advocate for a TRIPS waiver in the WTO to improve global access to vaccines, therapeutics, and diagnostics, so that the objective of having locally made vaccines is achieved. To get more life-saving vaccines to those in need, South Africa is donating 5 million doses of Pfizer vaccines and 10 million doses of J&J vaccine to other African countries to pledge our solidarity with those countries that are not able to access vaccines easier. South Africa has contributed $10 million to the Global Fund and plans to contribute financial support to the ACT Accelerator as well. To address low testing rates, African Union member states have committed to target a 200 million COVID tests by the end of 2022. At the same time, we will be implementing the Africa CDC's enhanced surveillance strategy for community-based testing, wastewater testing, and sentinel surveillance. The African Union Summit in February endorsed a common agenda for manufacturing vaccines, medicines, diagnostics, therapeutics, and health products on the continent. The continent's largest COVID-19 vaccine manufacturing plant opened in South Africa last year, and the WHO supported South Africa to become the center of the mRNA process and to have hubs for tech transfer in other countries such as Egypt, Senegal, Tunisia, Kenya, and Nigeria. However, this progress may be reversed because international agencies that have had a lot of money donated to for purchasing and procuring vaccines for developing economy countries are not buying vaccines from African vaccine manufacturers, even for those vaccines that are destined for African countries. This immediately just devalues the whole process of local manufacturing and local production of vaccines. This, ladies and gentlemen, must change. Multilateral agencies and also philanthropic organizations need to be procuring vaccines and boosters from African vaccine manufacturers to ensure that developing capabilities on the continent are retained. And as we heard from President Marquez, a number of African countries are now stepping up to produce vaccines for the 1.3 billion Africans who live on the African continent. And it is for this reason that we are calling for vaccines to be purchased for Africans on African soil. As South Africa and as the African Union champion for COVID-19 response, we call on the international community to ensure that solidarity and equity underpin this next phase in our management of the pandemic. This means that vaccines produced in Africa must be procured in Africa for Africa's people. This is vital for the continent's health security now and into the future. I thank you.
Thank you, President Ramaphosa. I'd like to introduce our next speaker, Canadian Prime Minister Justin Trudeau. Canada is a global leader in enhancing health security and financing the COVID response. And we understand he has some new announcements to make today. Mr. Prime Minister, you have the floor.
Thank you, Ambassador. Thank you to my friends Cyril, Pedro, John, and Maki for being here today. And thanks to President Biden and to you, Vice President Harris, for bringing us all together. For decades, Canada has been a strong supporter and advocate for global health. Over the past 2 years, the pandemic has shown us how interrelated we all are. Cette pandémie va seulement pouvoir se terminer quand tout le monde aura accès.
This pandemic will only end when everybody have access to enough tests, to therapeutics, and to vaccine. And the ACT-A accelerator certainly is our best tool in order to ensure that there is cohesion and cooperation between the various countries.
Canada has provided vaccine doses to countries who needed them. And we've made investments to help enable development and production of mRNA vaccines, which includes up to $15 million towards the establishment of the COVID-19 mRNA technology transfer and manufacturing hub in South Africa that Cyril referred to. But however we might all be wishing it is, the pandemic is not over. And as it persists, it changes. So does our global context. That's why we must continue to adapt our response. For example, supply is no longer the key constraint to COVID-19 vaccination globally. Countries face difficulties getting vaccines from tarmacs into arms, particularly for vulnerable populations and people in remote communities. Well, Canada's going to be there with support. We also look forward to continuing to work with all of you to ensure people have what they need to make informed decisions on vaccines. Together, we have to reinforce the continued importance of testing and treatments. This will help us identify dangerous variants and contain outbreaks. And we must be better prepared for the future by identifying and filling gaps in the international health landscape. The G7, the G20, and the private sector, everyone needs to do their part to support the ACT Accelerator. Today, I'm announcing new funding of $732 million for the ACT Accelerator. This includes funding to continue making COVID-19 vaccines available and funding to help low and middle-income countries support the health of women, children, and adolescents. Once again, Canada is immediately meeting its full burden share. We've now contributed a total of more than $2 billion to the ACT Accelerator since the start of the pandemic. J'encourage tous les autres pays à soutenir les efforts.
I strongly encourage all countries to support international efforts and to do their part. Indeed, it's by working together that we will be able to build a better future, protect the most vulnerable people, implement prevention, and ensure that our economies are more resilient.
So we can end this pandemic for everyone, everywhere. Merci, mes amis.
Thank you, dear friends.
Thank you, Prime Minister Trudeau, and congratulations on your leadership. I hope others will follow your lead. I'd like to introduce our next speaker, Ms. Joy Pumampi, who is the Interim Co-Chief Executive Officer of the Clinton Access Health Initiative. She is also a former Minister of Health of Botswana. She will be delivering a commitment today on behalf of her organization, as well as companies that she has been working with to expand access to tests and treatments for COVID-19. Ms. Pumampi, you have the floor.
Thank you so much, Ambassador. Your Excellencies and distinguished guests, the COVID-19 pandemic has taken an enormous toll on health and lives globally, making equitable access to effective oral antiviral medications, especially for those who are high risk, critical. Today, CHAI is announcing new agreements with leading generic manufacturers to make generic Paxlovid available in low and middle income countries for under $25 per treatment cost, ensuring equitable access that will save lives and reduce the burden on struggling health systems. Participating companies are well-established and trusted suppliers to the US PEPFAR. As leaders in the HIV antiretroviral market, they represent over 25% of global low and middle-income public sector procurement volumes per year. Under the agreements, the companies will guarantee production of an affordable generic version of the drug and dedicate capacity for 4.5 million treatment courses per month for low and middle income countries covered by their licensing agreements with the Medicines Patents Pool. Manufacturers will work to file for WHO pre-qualification or approval from a stringent regulatory authority like the US Food and Drug Administration by the first quarter of next year, and will register the product widely across licensed territories. In turn, CHAI will work with donors and our partner governments to raise procurement funding and pursue advanced purchase commitments to meet country needs. Partners like South Africa, like Zambia, like Nigeria are ready and able. They have demonstrated successful introduction of HIV treatments, such as the dolutegravir, which has been introduced, rolled out, and scaled up to millions of patients. Working together and through existing government systems and in collaboration with UNITAID, with WHO, the Global Fund, and ACT-A partners, CHAI will provide technical and strategic support to countries to integrate introduction of the medication with existing testing plans that align with their national COVID-19 response, building capacity for decentralized testing and treatment of high-risk patients by updating clinical guidelines, supporting national-level procurement planning, and engaging implementing partners and communities to align on product introduction and scale-up. Catalytic efforts by global partners are also necessary. Funding for operational research and initial rollout of test and treat approaches from partners such as UNITAID and FIND will be critical to provide the data to scale up efforts. funding for procurement of rapid diagnostics tests, medications by the Global Fund, UNICEF, the US government will accelerate entry of affordable, quality-assured generic products. We call on the international community to commit funding to making these treatments equitably available to end the pandemic and build resilient systems that can withstand future health crises. We thank you, Excellencies, the Global Fund, Unit 8, the UK government for their support, and want to acknowledge the leadership and contributions from the 8A diagnostic and therapeutic pillars. We thank you.
Thank you, Ms. Pumapi. That commitment could be game-changing, and I would like to thank you for your leadership in making it happen. Now I'd like to introduce our next speaker, India's Prime Minister Narendra Modi, to share India's new commitment to the pandemic response and your views on the future of pandemic preparedness. Mr. Prime Minister, you have the floor.
President Biden, Vice President Harris, Excellencies, Namaskar. The COVID pandemic continues to disrupt lives, supply chains, and test the resilience of open societies. In India, we adopted a people-centric strategy against the pandemic. We have made the highest ever allocation to our annual healthcare budget. Our vaccination program is the largest in the world. We have fully vaccinated almost 90% of the adult population and more than 50 million children. India manufactures 4 WHO-approved vaccines and has the capacity to produce 5 billion doses this year. We supplied over 200 million doses to 98 countries bilaterally and through COVAX. India has developed low-cost COVID mitigation technologies for testing, treating, and data management. We have offered these capabilities to other countries. India's Genomics Consortium has contributed significantly to the global database on the virus. I am happy to share that we will extend this network to countries in our neighborhood. In India, we extensively use our traditional medicines to supplement our fight against COVID and to boost immunity, saving countless lives. Last month, we laid the foundation of WHO Center for Traditional Medicine in India with an aim to make this age-old knowledge available to the world. Excellencies, it is clear that a coordinated global response is required to combat future health emergencies. We must build a resilient global supply chain and enable equitable access to vaccines and medicines. WTO rules, particularly TRIPS, need to be more flexible. WHO must be reformed and strengthened to build a more resilient global health security architecture. We also call for streamlining WHO's approval process for vaccines and therapeutics to keep supply chains stable and predictable. As a responsible member of the global community, India is ready to play a key role in these efforts. Thank you. Thank you very much.
Thank you, Prime Minister Modi. I'd like to introduce our next speaker, Spanish President Pedro Sanchez. Spain has also stepped up for this summit, and we look forward to hearing from you. Mr. President, you have the floor.
Thank you, President Biden, for co-hosting this very important summit and for inviting Spain to participate. My dear friends, the worst of the pandemic may be behind us, but it is not over yet. And there are lessons to be learned for future health crises. If global health is a public good, and no one would question that now, then we must act accordingly. In 2020, our main aim was to develop an effective vaccine against COVID-19. In 2021, the challenge was to produce and distribute it across the world. Today, in 2022, we need to get those shots in people's arms. Spain has managed to reach one of the highest vaccination rates globally while becoming one of the largest donors. We are the 7th largest vaccine donor to the COVAX mechanism and the 2nd largest donor in Latin America. But much remains to be done, which is why this summit is so timely. I would like to announce the following new commitments. First, Spain will allocate an additional $200 million in order to donate 30 million vaccines through COVAX and bilaterally. This will add to the 70 million doses already delivered. Therefore, if epidemiological conditions require it, Spain will donate a total of 100 million vaccines. Second, we must strengthen health system to achieve our goals. This is why Spain will commit 100 million euros to COVID-19 related development projects that will be implemented by the Spanish Agency for International Development Cooperation. In order to get better prepared, we must develop vaccines against new variants that might extend the duration of the pandemic. In this regard, my country, Spain, is supporting the development of a new protein-based vaccine by IPRA Human Health, which will be particularly effective. We must also improve global mechanism to transfer technology and decentralized production of health products across regions. For that reason, Spain joined the World Health Organization's COVID-19 Technology Access Pool, CTAP. And last November, the Spanish National Research Council finalized a licensing agreement for surgical antibody technology. This was the first transparent global non-exclusive license for a COVID-19 health tool. The World Health Organization described it as one of the top 10 global health landmarks in 2021. And we are also supporting concrete efforts for vaccine productions in Latin America. Last but not least, we have to protect, safeguard, and invest in health and healthcare workers. This is why Spain is co-leading the line of effort within the framework of the Global Action Plan developed by the US and other partners. We must act together, and Spain is ready to do so. Thank you very much. Gracias.
Thank you, President Sanchez and Spain, for your impressive new commitment and continued leadership. Let's keep it going. Now I'd like to introduce our next speaker, European Commission President Ursula von der Leyen, who is bringing another large new commitment to the summit.
Mr. President, dear Joe, Mrs. Vice President, thank you for calling the second Global COVID-19 Summit. Today's presence of leaders from across the world is a powerful signal. No issue is more important than people's well-being. We cannot be complacent because the pandemic is not over. Of course, safe and effective vaccines and better treatments have much reduced the pressure on our healthcare systems. And restrictions in many parts of the world are being lifted. But new variants will continue to emerge, and there is no guarantee that the next one will be mild. In addition, we must prepare for future pandemics or other health threats beyond COVID. So in the European Union, we are working hard to step up surveillance, strengthen our healthcare systems, and improve preparedness. None of us can do this alone. And this is why international cooperation and solidarity have been at the heart of our EU's response from the very beginning. Until now, Europe exported 2.2 billion doses of vaccine. In addition, Team Europe helped to set up and fund the ACT Accelerator and shared 470 million vaccine doses so far, because we know global cooperation, including our EU-US partnership, is vital to end this pandemic. We teamed up in our fight against COVID at the first summit in September. The joint statement we are making today proves that our close cooperation is advancing the global effort to end the pandemic. At our last meeting in September, we focused on sharing supply and local production, as well as on ensuring sustainable financing. Now we must take our commitment to the next level. The supply of vaccines has to go hand in hand with speedy delivery, especially in Africa. Today, I can announce that the European Commission makes a financial commitment to enable vaccine delivery in the countries in need. I also make a financing pledge to support the work of ACT Accelerator on diagnostics, therapeutics, and health systems. In addition, we make sure that all regions have the capacity to produce their own medicines locally. The recent agreement in the G20 to move ahead with a global pandemic preparedness fund is an opportunity for the global community. We will work together with the US and other partners to make it fit for purpose. I can announce today that the Commission envisages a significant contribution to this fund as soon as its governance is established. Ladies and gentlemen, the development of safe and effective vaccines in record time was an unprecedented achievement in the history of science. And it was international cooperation that made this success possible. I'm sure, Mr. President, dear Joe, that our summit today will strengthen the global cooperation we need.
Thank you, President von der Leyen. Your commitment speaks volumes about European unity in defeating the pandemic and preparing for the next. We now have several early financial commitments to capitalize on the political momentum that has been building and to continue growing commitments as we establish the Pandemic Preparedness and Global Health Security Fund this summer, in line with the Indonesian G20 presidency goals. But we cannot stop there. I want to call on all of you to support this effort politically, financially, and as the President said, now. I'd like to introduce our next speaker, President of South Korea, Yoon Sakyal. President Yoon comes to us from a pre-recorded message, but I want to wish him congratulations on his recent election.
Mr. President, Excellencies, ladies and gentlemen, it is an honor to take part in the Global COVID-19 Summit right after my inauguration as the 20th term President of the Republic of Korea. 2 years ago, WHO has declared COVID-19 outbreak a global pandemic. Since then, there have been multiple global efforts to overcome this crisis. The Republic of Korea has participated in joint efforts of the international community to win the battle against COVID-19 and to build a sustainable global health system. We will remain committed to supporting the international community's efforts to end this pandemic. The Republic of Korea will play its role and fulfill its responsibility. In this regard, Korea will contribute additional $300 million to ACTA. We will provide assistance to countries who are in urgent need of vaccines so that they can have enough doses of vaccines and have their people vaccinated safely and promptly. In addition, we will do our best to support developing countries move toward vaccine self-sufficiency by establishing WHO BioHub to train global bio-experts. With a view to strengthening international coordination, Korea will actively participate in global health security agenda as well. The Republic of Korea supports the establishment of Financial Intermediary Fund. FIF will enable the international community to mobilize sufficient resources in time so that we can be fully prepared to deal with future health crises such as new infectious diseases. Excellencies, ladies and gentlemen, global health crises like COVID-19 pandemic, which threaten the whole humankind, cannot be resolved by the participation of just one or a few nations. When more states work together in solidarity, we will be able to prevail over the challenges. The Republic of Korea will play its role as a responsible member of the international community. Working together is the right way to bring prosperity for humanity. I expect that through this second global COVID-19 summit, we will be able to find out better ways to overcome COVID-19 and strengthen global health security system. Thank you.
Thank you, President Yoon. It says a lot about South Korean leadership that this is one of your first acts in office. I'd like to introduce our next speaker, Colombian President Iván Duque Marquez, who will provide an additional perspective on enhancing vaccinations for the most vulnerable in his country and region. Mr. President, you have the floor.
My greetings to the President of the United States, Joe Biden, also to the German Chancellor Olaf Scholz, the Prime Minister of Belize, and the Presidents of Indonesia and Senegal. My greetings are also extended to all the participants in this event. Since its inception, this summit has been an opportunity for the world to move forward together on the joint commitment to overcome the crisis generated by COVID-19. All countries are encouraged to contribute to the best of their ability to secure funding for a multilateral response to the problems caused by the pandemic. In Colombia, we continue to provide a response aimed at protecting the most vulnerable, safeguarding the health of the population, and reactivating our economy. As a result, we have strengthened our healthcare capabilities. Consequently, thanks to the National Immunization Plan, we have succeeded in immunizing 83% of all Colombians with at least one dose. Likewise, almost 70% have been fully vaccinated. We have also made progress immunizing the Venezuelan migrants. Today, more than 600,000 of them have been vaccinated. For Colombia, equal access to vaccines is our priority. For this reason, we contributed $1.2 million to the Pan American and World Health Organization support vaccination in CARICOM countries. This is in addition to the technical assistance we have provided in the region based on the Colombian experience. In this regard, Colombia is recovering its sovereignty in the production of vaccines. The construction of a plant has already started in Colombia, with which we will be able to manufacture develop vaccines against COVID-19 and other diseases, allowing us to be better prepared for future health emergencies. Today, we are renewing our commitment to the vaccination process. Our goal is to continue sharing the best practices that have allowed us to move forward with our national plan. Likewise, We continue our call to strengthen the global health security architecture with transparent, inclusive, and collaborative processes. Colombia will continue to contribute to the discussion held by the World Health Organization to strengthen prevention and preparedness for pandemics, a call that is vital for our global future. Thank you very much for your support, and thank you very much for putting together this amazing summit in which we all contribute to strengthen the world healthcare system.
Thank you, President Duque Marquez. This is another example of a commitment that is vital to make, and we hope more countries can make similar commitments. The challenges posed by migration crises around the world are being exacerbated by the pandemic, and making commitments to make vaccinations and care available for these populations in humanitarian settings are so vital. I'd now like to introduce our next speaker, New Zealand Prime Minister Jacinda Ardern, whose swift and efficient COVID-19 response and recovery efforts made New Zealand a model for the world on effectively isolating the pandemic. Madam Prime Minister, you have the floor.
Tēnā koutou katoa. Greetings from Aotearoa, New Zealand. Thank you to the United States, Senegal, Germany, Indonesia, and Belize for hosting this summit to strengthen our collective efforts to end the COVID-19 pandemic as soon as possible for everyone, everywhere. President Biden, thank you for your leadership and for highlighting the importance of taking action now to fill urgent gaps in the international response to the current pandemic and future global health crises. Vaccines remain a critical tool in our collective response to the pandemic, and COVAX is at the centre of these efforts. While the global supply of vaccines has increased, significant challenges remain in turning these vaccines into vaccinations. At the same time, countries need to be able to access the tools they need to respond to the pandemic and build strong and resilient health systems, including testing, therapeutics, oxygen, and PPE. Aotearoa New Zealand continues to play our part. In this funding period, we have contributed over 14 million New Zealand dollars to the COVAX AMC for vaccine delivery and support, including fully funding all ancillary costs associated with our donations of 7.3 million doses of COVID-19 vaccine. In March, we pledged a further $10 million to CEPI over 5 years to support its continued work to develop COVID-19 vaccines and to prepare for future pandemics. Today, I'm pleased to announce we will increase our contribution to the ACT Accelerator by an additional 10 million New Zealand dollars for a total contribution of almost 70 million. 8 million will be directed to the Global Fund's COVID-19 response mechanism to support diagnostics, therapeutics, and health systems strengthening in developing countries. And over $2 million will be provided to UNICEF for the purchase of medical equipment in Vietnam and to maintain essential health services in the Philippines. Aotearoa New Zealand is committed to supporting global equitable access to COVID-19 vaccines and ensuring health systems in developing countries are supported to achieve widespread vaccination. We join the call for all donors and vaccine suppliers to work to ensure the maximum possible shelf life of donated COVID-19 vaccine doses, which is critical to making the fullest use of available supply. Together, with broader efforts to support health systems to deliver COVID-19 vaccination programs, this will help to better protect all populations from COVID-19. We also remain fully committed to supporting global efforts to prevent, prepare, and respond to future pandemics, with the World Health Organization playing a central role. Today, I'm pleased to announce Aotearoa New Zealand's in-principle support for a new global health security fund for pandemic preparedness and response. We look forward to engaging with others on this initiative. In addition, we will continue our close and constructive engagement at the World Health Organization to strengthen the international health regulations and negotiate a new international instrument for pandemic prevention, preparedness, and response. Alongside our contributions to multilateral efforts to end the acute phase of the pandemic, we're committed to supporting the needs of countries in the Pacific region. In partnership with Pacific neighbours, we're providing fiscal budget support, outbreak management support, and crucial equipment and supplies, including vaccines, testing kits, oxygen, and PPE. Through the Polynesian Health Corridors Program, we've been proud to support the 6 Polynesian countries and Fiji to achieve excellent vaccination coverage through bilateral donation and to share our technical knowledge and experience of responding to COVID-19 so we can all learn from each other. We must also do all we can to end the current pandemic as quickly as possible. We also need to prepare for future global health crises. Only by working together can we do both. E hara taku toa, e te toa takitahi, inare he toa takatini. Success is not the work of one, but the work of many. Thank you.
Thank you, Prime Minister Ardern. I'd like to introduce our next speaker, Italy's Prime Minister Mario Draghi. Prime Minister Draghi, you led the G20 last year and helped bring the leading economies through sustained crisis. Thank you for your continued leadership on these issues.
President Biden, colleagues, it is a great pleasure to be at this second Global COVID-19 Summit. I would like to thank President Biden and all the organizers for hosting this important meeting. The development of effective vaccines and the organization of successful vaccination campaigns have marked a turning point in the fight against pandemia. In many of our countries, we have removed restrictions, reopened schools, restarted the economy. We have saved lives, and we have returned to a normal life. But, as we know all too well, the pandemic is not over. Since the start of the year, we've had an average of 1.7 million COVID-19 cases a day worldwide. We're still behind our shared objective of vaccinating 70% of the population in all countries by mid-2022. The vaccination gap is closing, but the coverage rate in some countries remains below 10%. Italy has already contributed to the multilateral response to the pandemic with 445 million euros and has already pledged 69.7 million doses via COVAX. Today, I can announce that Italy will donate an additional 31 million doses through COVAX, and we are also pledging 200 million euros via the ACT accelerator and in order to strengthen global preparedness. Italy's G20 presidency has launched a joint finance health task force to explore a new facility to fund pandemic prevention, preparedness, and response. It is essential to achieve a broad consensus on an inclusive facility with the WHO at its center in order to ensure its effective implementation and a broad-based financing. Italy is strongly committed to ending this pandemic and to preventing future ones. We stand ready to continue working together with urgency and determination. Thank you.
Thank you, Prime Minister Draghi. I'd like to introduce our next and final speaker for this session, Japan's Prime Minister Fumio Kishida. Japan remains a leader in global health, and you have been at the forefront of supporting multilateral efforts like Act A. We welcome your remarks to hear how Japan will continue these commitments.
バイデン米国大統領、ブリセーニョ・ベリーズ首相、ショルツドイツ首相、 ジョコ・インドネシア大統領、サル・セネガル大統領、ご参加の皆様、新型コロナがパンデミックと宣言されてから2年以上経つ今も、世界の至るところで人々の健康が脅かされ、経済社会の発展が阻まれています。我々はこのパンデミックを終焉させ、より良い健康安全保障を構築し、ユニバーサルヘルスカバレッジを達成すべく、具体的な取り組みを加速させていかなければなりません。日本は米国主導のグローバル行動計画の中で、特に世界におけるワクチン接種の促進のリード国として貢献しています。COVAX に対し拠出済みの10億ドルに加え、最大5億ドルの追加支援を行います。また、CEPI に対し、今後5年間で3億ドルを新たに拠出します。さらにこれまで実施した約4400万回分のワクチンの現物供与に加えて、各国地域における輸送接種体制を強化するラストワンマイル支援を計77カ国地域に広げ、約 1.6 億ドル規模で実施してきています。ワクチンを含む医薬品、医療品の現地生産能力強化も重要であり、今般アフリカにおける能力強化のため、JICA を通じて最大2億ドルの支援を行うことを決定しました。これらの取り組みがより一層効果的にワクチン接種の促進につながるよう、現場での連携強化にも貢献していく考えです。日本の新型コロナ感染症対策に関する途上国支援は、これまでに総額約45億ドルとなり、先に述べた COVAX に対する最大5億ドルの拠出と合わせ、約50億ドルの支援を力強く実施していきます。また、より良い健康安全保障の構築に向け、将来のパンデミックへの予防、備え、対応を強化するためのグローバルヘルスアーキテクチャの強化に積極的に貢献していきます。このため、国内資金動員のさらなる促進や、既存機関の活動を補完する資金メカニズムとして、世銀に新たな基金を設立することを指示します。WHO 改革、パンデミックに関する新たな国際文書の策定や国際保健規則の改正にも積極的に関与していきます。日本は日米豪印首脳会合、TICAD8、来年の G7 をはじめ、日本が主催する関連会合も念頭に、UHC の達成に向け、引き続きリーダーシップを発揮していく決意です。ありがとうございました。
Thank you, Prime Minister Kishida, for closing us out particularly strongly with those impressive commitments. And thank you all for your insightful comments and the spirit of collaboration this group has shown today as we come together to end this global pandemic. I'm encouraged by the leadership and the political and financial commitments we've seen so far this morning. With everyone's hard work, we can continue to make ending the pandemic a top priority, even as we simultaneously deal with other crises. And if there's one thing I'm taking away from this first session, it's that as we tackle COVID-19 and save lives, we also have to ready ourselves for future threats. Every single country has a role to play in this fight. We must come together to ensure testing and treatment is accessible to all, to support heroic frontline healthcare workers, and to strengthen our public health infrastructure. And while we're making real progress in our efforts to vaccinate the world, we know that too many people are still out of reach, especially those living under conflict and instability. This is an issue the UN Security Council took up just last month, and I'm glad to see it's the focus of today's next session. I look forward from hearing the next group of leaders on how we can all facilitate access to vaccines for the vulnerable and hardest to reach populations around the world. Thank you.